Curious about Latisse? You're not alone. Allergan, the creators of Latisse, are giving me the opportunity to have my questions answered by real Latisse users and a doctor, so that we can feel comfortable taking the next step, talking to our doctors. This is Dr. Deanna Glazer. She's a dermatologist, and this is McKenna Bree and Kai Lee. Welcome, ladies.
Thank you.
I have to say, I'm really intrigued by this product. Dr. Glazer, can you give me a little background on it?
Sure. Latisse Solution is a prescription product that grows lashes for people with inadequate or not enough lashes. It's the only FDA-approved prescription product that grows lashes. And what's really great about this product is that it delivers longer, fuller, darker lashes.
Great. What about you ladies? What got you interested in Latisse?
I always felt like my lashes weren't very visible, and that's what got me to talk to my doctor. And I'm so glad that I did, because Latisse worked for me. And the results I got were great, and they still are.
Wow, so these are your real lashes? They're not retouched?
Nope, no retouching on my lashes. I did not wear mascara in those pictures. Those are my real lashes.
What about you, Kai? How was your experience with Latisse Solution?
Well, I've always been a bit lash challenged, so when my doctor prescribed Latisse, I was really excited to start seeing my lashes grow. Now you can actually see my lashes.
So how long does it take to start seeing results?
Generally speaking, people start to notice length by week 4, and then gradually they see more fullness and darkness. And by week 16, they get the full results. So don't cheat yourself. Use the product nightly for the complete 16 weeks to get the full dramatic results.
Yeah, it happens gradually. It's not overnight, but your lashes really are growing.
Honestly, time flies by.
And what happens when you stop using the product?
Well, then your lashes will go back to the way they were before, within a few weeks to months.
Now, tell me what I should know about potential side effects.
The most common side effects are eye redness and itchy eyes. There's also eyelid skin darkening, which is less common. And that's where the eyelid skin may look a little darker close to where the solution is applied to the skin, but this is expected to reverse after several weeks to months if you decide to stop using the product.
What is this I hear about eye color change?
Although eye color change was not seen in the Latisse clinical studies, you should know about the risk, which is likely to be permanent. There is a risk for it because the risk was reported when the same formulation of bimatoprost ophthalmic solution was instilled directly into the eye to treat elevated intraocular pressure.
That makes sense. Dr. Glazer, tell us what you've seen with your patients regarding side effects.
My patients' results are pretty consistent with the clinical trial results. The side effects are generally mild and tolerable. But the truth is, Latisse Solution affects everyone differently. You know, results may vary. If you have any questions, by all means, talk to your doctor.
And what about my eyes? Can Latisse affect my vision?
No, Latisse Solution should not affect your vision. Even if you do get some in your eye, it's not expected to cause harm. You don't need to rinse it out.
Now let's get to the nitty-gritty. How much does Latisse cost?
Costs about $120 a kit.
And you can also get the scoop on discounts through Lash Perks on the website, so definitely sign up for that.
Okay, great. Which doctor do I ask?
Well, many types of doctors can prescribe Latisse, but not all may be familiar with it. So if you're not sure if your doctor is, just call up and ask. You can also find a doctor in your area on the Latisse website.
I went to my dermatologist. I usually go there anyways for skin checkups.
You can just ask about it at your next doctor's appointment.
Should I wait a little longer to try it?
Why wait? If you're interested, talk to your doctor.
I got great results.
Ladies, this has been great. Thank you so much. I've gotten a lot of information and learned a lot of stuff I didn't know about. Just listening to your experiences and having a doctor here to answer my questions, it's been really helpful. I feel like I'm ready to talk to my doctor now. If you're ready to start growing your lashes, ask your doctor if Latisse is right for you.
If you're considering asking your doctor if Latisse is right for you, here's some important safety information you should know beforehand. Latisse Solution is a prescription treatment for hypotrichosis used to grow eyelashes, making them longer, thicker, and darker. Eyelash hypotrichosis is another name for having inadequate or not enough eyelashes. If you are using or have used prescription products for any eye pressure problems, only use Latisse under close doctor care. Although not seen in Latisse clinical studies, may cause increased brown pigmentation of the colored part of the eye, which is likely permanent. Eyelid skin darkening may occur, which may be reversible. Only apply at the base of the upper eyelashes. Do not apply to the lower eyelid. Hair growth may occur in other skin areas that Latisse solution frequently touches. If you develop or experience any eye problems or have eye surgery, consult your doctor immediately about continued use of Latisse. The most common side effects after using Latisse solution are itchy eyes and/or eye redness. If discontinued, lashes will gradually return to their previous appearance. For more information on Latisse, please see the full prescribing information on latisse.com. Now that you know the facts about Latisse, you should also know a few precautions to take when applying Latisse solution. First off, you want to be sure to apply Latisse correctly. The complete instructions are posted on the How to Apply page of latisse.com, along with a useful video demonstration. Before you apply Latisse, you'll need to remove all your makeup. Then you'll want to apply the Latisse solution on the skin of the upper eyelid at the base of the eyelashes. Do not apply it to the lower lid, and if any solution runs off, blot it with a tissue. Excess hair growth can occur in areas of the skin where Latisse frequently touches. Also, it's important to use the applicators that come in the Latisse kit. These are sterile applicators and should only be used one at a time. One applicator for each eye each time you apply. If you're a contact lens wearer, you'll want to be sure to remove your contacts before applying your Latisse solution, and then you can reinsert them about 15 minutes afterwards. You'll also want to be careful handling the product, so don't allow the tip of the bottle or the applicator to contact surrounding structures, fingers, or any other unintended surface in order to avoid contamination by common bacteria known to cause infections. You should also know that your results may vary from eye to eye. There may be a difference in eyelash length, thickness, and fullness, perhaps variations in pigmentation or darkness, number of eyelash hairs, or the direction of the eyelashes. If you do experience any of these variations in your lash results, they will usually go away once you stop using Latisse. And remember, if you do stop using Latisse at any time throughout the course of your treatment, your lashes will gradually return to their previous appearance within a few weeks or months. So you should stay on the product for the full 16 weeks in order to achieve the full results. After that, you should talk to your doctor about ongoing usage. If you are using any products to lower eye pressure, known as IOP, meaning intraocular pressure, or if you have a history of abnormal IOP, you should use Latisse under the close supervision of your physician.